This is personal long axis view. We add color flow to it. Okay. The M mode from the long axis view. Now with the rotation clockwise and tilt towards the right shoulder, left shoulder, this is the RV outflow tract, pulmonic valve, adding color flow, shows a small PDA. We can have Doppler in this view also. That's the flow of the pulmonic valve. Back to the long axis, and with the counterclockwise rotation and tilting downward, we're going to demonstrate the RV inflow and the tricuspid valve, adding color flow to it. Shows the pulmonary venous drainage to the left atrium and the foramen ovale, left to right shunt. Now, rotation clockwise 90 degrees for the short axis view. And tilting all the way to the apex. This is short axis LV apex. And then moving to the level of the papillary muscles. In the short axis view, we can do M mode here. F4. For the measurement purposes. And now at the level of the mitral valve. Okay. And just tilting towards the base, and shows the short axis at the base with the aorta in the middle, pulmonary artery branches, and the PDA with the color flow. Left atrium behind the aorta and the right atrium next to the aorta. And this is demonstrating the Doppler flow through the pulmonic valve. And the M mode of the aortic valve for evaluation of the LA-AO ratio. Okay, next window. We're moving to the apex.
Start from posterior.
Start from the posterior. This is the four-chamber view, looking at the posterior aspect of the left atrium and the mitral valve with the coronary sinus coming to the right atrium. Minor rotation clockwise and tilt anterior to the four-chamber view. Mitral valve, tricuspid valve, atrias. And the color flow demonstrates the pulmonary venous flow to the left atrium and then through the mitral valve and tricuspid valve with the minimal tricuspid regurgitation. The Doppler of the mitral valve. No M mode available. Now rotation more clockwise and tilt more anterior is going to demonstrate the left ventricular outflow tract and the five-chamber view. Aortic valve. Color flow. And a Doppler. And rotation more clockwise and tilt anterior till we reach the RV outflow tract and pulmonic valve from the apex, and the color flow demonstrate that. Next window, moving to the subcostal area, the marker to the left, and coronal view posterior, atrial septum and color flow. Shows the pulmonary venous drainage to the left atrium. That's it. We're going tilting anterior to the LVOT and the aorta. It's a more anterior aspect from the coronal view, and color flow shows the pulmonary artery next to the aorta with the PDA. And we tilt more anteriorly at this point. We're going to bring in the RV outflow tract and the pulmonic valve coming out of the right ventricle. And color flow shows that, plus PDA. Note the false tendon in the left ventricle. At this point, rotating clockwise, the marker now is to the left leg. And we're going to start sagittal cuts from the apex. Sagittal cut at the apex. And then we sweep to the right side of the patient. We're going to bring in the RVOT and the pulmonic valve. Color flow. Sweeping more to the right side of the pulmonic, we're going to bring in the aorta to the aortic arch, LV outflow tract. And this is the color flow, shows the aorta. Sweeping to the right side of the aorta, we're going to bring in the bicaval view, superior vena cava, coming to the right atrium, atrial septum, pulmonary veins with the color flow. There is not much atrial shunting at this patient. This is cross-section abdominal aorta, inferior vena cava from subcostal to demonstrate the situs. The color flow shows the pulsatile aorta in front of the vertebrae and the inferior vena cava to the right in the liver tissue almost. 90 degrees rotation. 90 degrees rotation, marker to the head and neck. This is the longitudinal cut of the aorta with the celiac trunk and SMA coming out of it. And tilting to the, this is the color flow, tilting to the right side of the aorta, we demonstrate the inferior vena cava and hepatic system entering the right atrium. And this is the color flow demonstrating the same thing. Next window, it's supraesternal, turning the head of the baby to the right, to the left side, giving enough room to put the transducer in the right side of the supraesternal and bring in the aortic arch. With the neck vessels, color flow shows the aortic arch and neck vessels plus the left atrium behind on the posterior aspect with the right pulmonary artery under the aortic arch. We do a rotation clockwise and tilt to the left side of the baby. This is the ductal cut demonstrating the pulmonary artery branches and the PDA with the color flow, and we still see the LA behind the aorta. And if we continue rotation clockwise and tilting downward, we will demonstrate the, at this point we're demonstrating the crab view, the pulmonary artery, aorta and the left atrium from supraesternal. Color flow demonstrates the 4 pulmonary veins crisscrossing in the left atrium behind the aorta and the pulmonary artery. Now if we just start tilting towards the head and neck, we can demonstrate the innominate artery for the sideness of the arch. Innominate artery comes and bifurcates to the right side of the patient, and the color flow demonstrates that. Rotation. The pulmonary, innominate artery taking off from the aortic arch going to the right side, branching to the right carotid and right subclavian. Demonstrate this is a left-sided aortic arch with the color. And now, rotating counterclockwise, the marker to the head and neck, superior vena cava entrance to the right atrium with the right atrial appendage, and the color flow demonstrates that. The structures next to the superior vena cava is the pulmonary veins and the right pulmonary artery and the azygos vein coming to the right to the superior vena cava right before entering to the right atrium.